in the context of not wanting to talk about a pregnancy, not wanting to tell anyone you're pregnant because of what you've just brought in of your cultural beliefs, or you're going to put some negativity on this situation. How do we bring our communities with us in a culturally sensitive and humble way?
I think it's really important for me, Manju, to understand that there is no such thing really as black. It doesn't exist. Black people are not a monolith. I said that to say that everybody's beliefs and approach are going to be slightly different. And I think there's something about having the what-if conversation with them, and how would that make you feel, and how does that work out in your culture? So asking people what they're, rather than declaring or proclaiming, I think we always have to start on the positive note. When we think about, fruitfulness, progeny and, offspring, it's such a big thing. So there's something about starting with the positivity, and somehow, even if this is going to be a bad, so-called bad ending, let's start with the positivity in the cultures. Have you ever wondered why, particularly in a lot of African cultures, when a girl starts menstruating, the parents want to throw a party?
Yeah.
Like, even me, I'm a British-born Nigerian. When my daughter, I've only got one daughter, when she started her periods, my husband and I were like, hey, God, praise the Lord. Oh, you were dancing. Because, do you know what that means? It means that this person has the tendency to be fruitful. It's such a big deal. Interestingly, therefore, you've kind of got your eye now on the womb, watching. So we talked about preconceptional advice. From the time that our daughters start periods, we're already giving them we're already, don't do that. You don't have babies. Don't do this. So there's something about understanding the importance of that. And therefore, talking about the positivity, almost understanding how celebratory it is. And I know we're speaking very, very hypothetically, because sometimes it can be a shock or a surprise. But then taking them down the positive route, and then, engaging in the what-ifs and how they would manage it, and what kind of support would they like to see, and allow them to talk about what their support mechanism looks like. And prepare yourself for things that you don't understand. So in some communities, that may be true. I may have this risky pregnancy. In my community, we may pray about it. I may have hands laid on me. We may fast. And when that conversation's open, you can almost have a dialogue to say, I understand why you do that. If you are going to fast, then here's some things to be careful of. So I don't think we should run away from the truth. Often in the Black African, Black Caribbean communities, it's not what is said. It's how it's said. And because of the nuances, we are reading your eyes, we are reading your leg, we are reading your hands, we're reading everything. Remember, in a system, for many, that people already don't feel comfortable at. So in the Black majority church, particularly in the African churches, in Africa, a lot of babies are born in church. A lot of churches have midwives and maternity homes. Why? It's a trusted place. So now that cultural memory kicks in, it's like, I don't know, maybe I should, maybe. And of course, the elders will be happy to deliver, this child. So it's important. How do we help them to understand the system, but also understand their system? And I do think it's a journey. It's not going to happen overnight, but there's a new posture that we need to be taking. It's being culturally humble. It's letting them, you're the expert, aren't you, you're the expert doctor. Letting them know that I respect you as an expert. Bring me into your expert area of being you. And I think, let's not run away from the truth, but also let's understand, so I mentioned that Black people are not a monolith. So understand who you're talking to. Are they somebody that's just arrived in the country? Are they somebody who's lived, in the UK for a while? How embroiled are they in the medical system? And I think there's something about talking to them and understanding that. Then we can have a bit more of a tailored conversation where I think people can tell really quickly when you care. when you care about me and my baby, when you care about my concerns. And therefore, I think the conversation can be facilitative, even if it ends with bad news.
Yeah.